Last night we told you about a little girl with COVID pneumonia. It was so bad she had to be hospitalized.
Today we are taking a closer look at the treatment that helped get her home. Janelle Bluda has more on how Remdesivir is being used in young children, even though it's not approved for them yet.
Remdesivir is an infusion of drugs. It's an antiviral medication that works by stopping the virus from spreading in the body. But doctors say it's best to use it early on for it to have the most impact. Hospitalized with COVID pneumonia, 6-year-old Julie was having a hard time getting better, so doctors wanted to try something different.
That's when they came in and discussed the option of an experimental treatment.
Desperate to help her little girl, Mom Holly said yes, so she says doctors gave her Remdesivir. But the catch, it's only FDA approved for kids 12 and older, and Julie's 6.
Like, you can actually find case reports of infants having received it. So
Dr. Michael Chang, assistant professor of pediatrics at McGovern Medical School at UT Health, says the FDA has granted emergency use authorization for kids under 12 who are hospitalized.
you want to try to use all the tools that you think you have that can help that child.
He says the first treatment would be steroids, but then a doctor might try Remdesivir.
You know, I think the Remdesivir has potentially benefit in specific situations. But I don't think that every patient that gets Remdesivir should expect, you know, a dramatic improvement in how they're feeling.
But Dr. Amy Arrington at Texas Children's Hospital in Katy says a child has to first be a candidate.
So a child that comes in that's classified as severe COVID-19 disease. So any child on oxygen or escalating support.
But says the majority of those children who are severe do get Remdesivir. And she says it's hard to know exactly how well it works in kids. Studies have only been done on adults, and that data does show a decrease in hospitalization.
Hopefully it helps kids from getting sicker and ending up in the ICU with me. But those studies, of course, are ongoing and yet to have the results published.
But for Julie, something worked because the very next day she went home.
It was just amazing, amazing, amazing.
In Houston, Janelle Bluda, KHOU 11 News.